Hey everyone, and welcome back. I am so thrilled to have you all here for part 2 of our Physical Therapy Masterclass Explainer. If you joined us for part 1, you know we've been building a really rock-solid foundation for physical therapy coding. Well, today, we're taking a massive step forward. We're going to focus entirely on a very specific and honestly often misunderstood category, supervised modalities. We're going to take a deep dive into hot and cold packs under CPT 97010 and mechanical traction under CPT 97012. Okay, let's dive right into our syllabus for today's explainer. First up, an intro to supervised modalities. Then we'll break down CPT 97010 for hot and cold packs, followed by CPT 97012 for mechanical traction. After that, we'll cover billing best practices and wrap up with a look at what's coming next time. All right, Section 1, Intro to Supervised Modalities. Let's start by defining our cornerstone here. A supervised modality is the application of a physical agent to produce a therapeutic change. But here is the absolute, non-negotiable rule: it does not require direct one-on-one patient contact by the provider. We're using what I like to call a clinical to coding pipeline approach here, mostly because, well, you truly can't code what you don't clinically understand, right? So think of supervised modalities this way. The clinician sets up the treatment, makes sure the patient is safe and comfortable, and then they can actually step away to treat someone else. Because the provider isn't constantly at the patient's side, these are categorized as untimed service-based codes. From a billing perspective, whether that hot pack is on for 10 minutes or 25 minutes, it's billed as a single unit per date of service. That untimed nature is the fundamental rule that coders, billers, and clinicians just absolutely have to commit to memory before a single claim goes out the door. Moving right along to Section 2, CPT 97010, hot and cold packs. Now this is where it gets interesting. Even though they share the exact same CPT code, hot and cold packs are essentially physiological opposites. Imagine the human body is like an engine. Hot packs use high-temperature thermal energy to really rev that engine up. They provide incredible pain relief by opening up those blood vessels, increasing local blood flow, dramatically ramping up cellular metabolism, and increasing the elasticity of connective tissue so they can be stretched out. But conversely, cold packs hit the brakes. They use low-temperature cold energy to constrict blood vessels, decrease blood flow, reduce swelling or edema, and literally slow down the metabolic demand of the tissues. It's a completely different clinical mechanism. And because the physiology is so drastically different, clinicians have to clearly document these specific effects to prove medical necessity for whichever thermal energy they choose to apply. So, why is this so critical to understand for billing? Well, applying heat to acute inflammation is literally like throwing gasoline on a fire. When you're auditing a patient's chart for a hot pack, you want to verify specific indications, things like pain reduction, muscle spasms, or joint stiffness. But, and this is a big but, if a chart lists peripheral vascular disease or neuropathy and a hot pack is billed, that is a massive red flag. Neuropathy means the patient has sensory deficits. If the heat is burning them, they might not even feel it. Plus, severe cognitive impairments mean the patient can't communicate that the pack is too hot. Because heat actively increases blood flow, it'll exacerbate acute inflammation, induce severe edema, and make infections way worse. So for sure, a clean claim requires the absolute absence of these contraindications. On the flip side, cold packs brilliantly target exactly what hot packs can't. They are the absolute go-to for acute inflammation, edema, arthritis flare-ups, bursitis, and fresh muscle or ligament strains. But you guessed it, they come with their own strict warnings that coders have to watch out for. Cold packs are heavily contraindicated for vascular conditions like Raynaud's disease or phenomenon, deep vein thrombosis, and just general hypersensitivity to cold. Just think about the physiology for a second. Cold constricts blood vessels, right? If a patient already has compromised blood flow from a DVT or peripheral vascular disease, applying cold can actually cause severe tissue damage. So the clinical presentation documented in the patient's history must align perfectly with the physiological effects of the modality. Otherwise, it just won't pass any level of coding scrutiny. Let's switch gears and build on this clinical knowledge. Section 3, CPT 97012, mechanical traction. Mechanical traction is a genuinely fascinating modality. Actually, the basic therapeutic principles of traction date all the way back to Hippocrates. Today, though, the mechanism of action involves highly sophisticated machines that use targeted stretching and pressure to elicit a therapeutic effect. Unlike a hot pack, which relies on thermal energy, traction is entirely mechanical. Whether it's applied as cervical traction up in the neck or lumbar traction down in the lower back, the machine provides a highly specific distracting force to the spine and intervertebral joints. By physically and methodically pulling those structures apart, it stretches the surrounding ligaments, paraspinal muscles, and facet joints. This action actively decompresses the spine, which provides immediate relief for nerve root irritation and disc irritation. Essentially, it creates the physical space the body desperately needs to heal itself. Now, as a coder or an auditor, your eyes should dart straight to the diagnosis codes the exact second you see 97012 billed on a claim. Because the mechanism of action is so specific, the medical necessity documented in the chart has to be equally specific. You're really looking for complex spinal diagnoses documented by the clinician. We need to see things like disc herniation with active nerve impingement, spondylolisthesis, or a narrowed intervertebral foramen. You simply cannot bill mechanical traction for a generic mild backache or standard muscle fatigue. No way. The diagnosis must clinically require that powerful mechanical distracting force we just talked about. If the diagnosis doesn't match the intense mechanical nature of the treatment, the claim will, and quite frankly should, be denied.
All right, bringing the clinical and the coding together in Section 4, Billing Best Practices.
You know the old saying, right? If it wasn't documented, it wasn't done. That phrase literally haunts the dreams of medical coders and billers everywhere. When it comes to efficient billing for supervised modalities, the medical record submitted must undeniably be comprehensive. The documentation has to vividly paint a picture of the patient's exact impairments and functional limitations that actually require a skilled intervention. You have to describe the patient's prior functional level to establish a realistic prognosis. Furthermore, the clinician has to justify that the specific type, frequency, and duration of the therapy are medically necessary for that individual's unique condition. And finally, even though these supervised modalities are untimed, the records still most clearly document both the treatment minutes for the specific modality and the total treatment time for the entire visit. This mathematical breakdown proves what was done and legally justifies the single unit billed. And that brings us to our final stop, Section 5, Next Time and Outro. So, you've officially mastered the untimed supervised modalities, the ones where the provider can safely set up the treatment and step away. But here is the multi-million-dollar question for you to ponder before our next explainer. Are you truly prepared for the relentless, strict mathematics of the 8-minute rule? Next time, we're tackling constant attendance timed codes. We're going to dive deep into neuromuscular re-education, therapeutic exercises, and the exact formulas you need to bill multiple units correctly. In that world, one single miscalculated minute can result in a completely denied claim. You absolutely won't want to miss it. Until then, stay focused, keep learning, and decode healthcare with Harshal.